All right, welcome to the Naloxone Administration Training provided to you by the Wisconsin Department of Health Services. My name's Sadie. I'm going to walk with you through this training as a part of the Apricity onboarding. So today we're going to go over quite a few things. We'll start with what is an opioid, moving then into recognizing and responding to an opioid overdose. The remainder of this training, points D through F, are optional as far as this training goes, so please feel free to request this PowerPoint to be able to look over those additional materials should you find yourself interested in doing so. Section A, what is an opioid? Opioids, any drugs that contain opium or its derivative. Opioids being natural or synthetic, they could be prescription medications or illegal drugs, in pills, capsules, powders, dermal patches, or in a liquid form with the ability to be swallowed, smoked, snorted, or injected. Opioids typically being used to manage pain, suppress coughs, and sometimes being used to treat opioid use disorder itself. Opioids causing feelings of euphoria, contentment, or detachment with effects lasting from 3 to 24 hours after initial onset of use. The most important point being here at the bottom that in excessive amounts, opioids can suppress a person's ability to breathe. How do they work? Opioids bind and activate to receptors in the brain that trigger the release of dopamine. Dopamine, right? It's a neurotransmitter connected to learning, pleasure, reward. It's a feel-good neurotransmitter. So over time, what then happens is that the opioid use changes the amount and the sensitivity of the receptors for the dopamine, which cause people who are using it to need a continuous supply of opioids to feel normal. You'll notice here that this diagram shows the opioid receptors in the brain and how the opioids themselves fit exactly onto the receptors. We have a chart here with a list of prescription opioids. There's some on here that may be familiar to you. Things like oxycodone or hydrocodone, codeine, buprenorphine, methadone, and fentanyl. There's also brand names listed on the opposite side with Oxycontin, Percocet, Opana, Vicodin, a plethora of options. So example of illicit opioids, heroin, non-pharmaceutical fentanyl. So this being illicitly produced, a synthetic version of the drug, supposed to be packaged to look like prescription medication or similar to heroin, but maybe up to hundreds of times more potent than heroin itself. Fentanyl is also being mixed with other drugs, including cocaine, methamphetamine, and marijuana, which puts people who do not typically use opioids at a higher risk of overdose. And keeping in mind, it's not just people who have substance use disorders who are susceptible to an opioid overdose. Anyone who takes opioids is at risk of an overdose, especially older adults who have the potentiality to confuse their doses. A piece on fentanyl exposure. Overdosing on fentanyl just by touching it or simply being in proximity to it is extremely unlikely, but it's not impossible. Overdose by contact has been such a persistent myth about fentanyl since it began supplanting heroin in much of the US's illicit opioid supply, but still these stories are a myth, and they really perpetuate as such. So keeping in mind that helping people who are using drugs can be dangerous, to use necessary caution, using certain equipment, right? So using gloves, washing hands, things to that effect. Keeping in mind, fentanyl is really only dangerous if it's ingested and gets into the blood stream or is, snorted or used in a various other route. If you do get fentanyl on your skin, use soap and water to wash it off. And make sure you and others are safe when responding to an overdose. Whether that includes wearing masks, covering your eyes, mouth, and nose after touching surfaces, or really anything that could be potentially contaminated by fentanyl. This next slide is pretty interesting. So these 3 bottles show roughly equal strengths, right? So fentanyl is about 100 times stronger than heroin, and carfentanil is about 50 times stronger than fentanyl. So you'll notice the progressively smaller amounts between the 3 vials. So let's spend a little time talking about what an overdose on opiates is. So an overdose occurs when a toxic amount of the opioid has been entered into the body, right? It overwhelms the body abilities to handle it. That could be an opioid alone or an opioid that's been mixed with other drugs or other substances. Mixing opioids could result in an overdose, whether that be the use of opiate painkillers or illicit opioids with benzodiazepines, cocaine, or alcohol. Here's the impacts on the body, right? So an overdose causes respiratory failure. The lack of oxygen in the blood causes for vital organs to begin to fail, including the heart and the brain, which can result in unconsciousness, coma, and even death. So signs and symptoms of an overdose: unresponsive, unconscious, breathing that's shallow, it's slow, or maybe the person isn't breathing at all, a pulse that's slow or maybe is even erratic, sounds of snoring, maybe even gurgling type noises, a defining feature, right, the pale gray clammy skin, fingertips, lips, and feet turning a bluish sort of color. So keep in mind, time is really important when a person is unconscious and not breathing. Permanent brain damage begins after about 4 minutes without oxygen, and death can occur between 4 to 6 minutes later. Not all of these symptoms might be present at the time of a life-threatening overdose. So remember to focus on low, shallow breathing or no breathing. So what is naloxone? This is a medication that reverses opioid overdose by restoring breathing. It's important to stress, to really stress some of the common misconceptions about naloxone, which we'll get into shortly. All right. So about naloxone, its delivery can be intramuscular, intranasal, or intravenous. For the sake of apricity, we use the intranasal route, which we'll talk about specifically a little bit later. Keep in mind that naloxone does wear off within 30 to 90 minutes after use, and so time is still an important factor when a person is experiencing an opioid overdose. Naloxone is safe for children, pregnant women, pets. I don't think we need to worry about pets here. There's really no significant side effects, and there's no potential for misuse or for getting high off of naloxone. It's only effective in reversing an opioid overdose, and will have no effect on someone who hasn't taken opioids. So how does naloxone work? So the brain has many receptors for opioids, right? We talked about that, and we had seen our little diagram a few slides ago. So when too much of opioids fit in too many receptors within the brain, that's when an overdose occurs. So naloxone has the ability to knock off some of the opioids off of the receptors and bind to the receptors for a short period of time, right? So this blocks the effects of opioids and is able to then restore breathing. So again, here you'll notice the same chart that we had used before with a couple differences on here. So this is an example of how the naloxone works in the brain to block opioids. So think of this, right? So everyone has used magnets on their refrigerator. You basically have like two types of magnets, right? The free advertising magnets from like your local realtor or from pizza shops or, you know, whatever, that they don't really hold anything up on the fridge. And you have the other magnets that are the really strong magnets that you use to hang up kids' artwork or, you know, wedding RSVPs or what have you. So opioids are much like the pizza magnets. They attach to the receptors in the brain, but the attachment isn't very strong. So naloxone comes in as this industrial strength magnet. It comes into the brain, it kicks the opioids off the receptors, and then it blocks the receptors. The opioids are still in the brain, but because the receptors, you know, are attached, are being blocked by the naloxone, they just kind of float around wherever. So the issue being that naloxone wears off faster than the opioids do, which means that the opioids can reattach and someone can go back into an overdose. That's why it's so important to be calling 911. So naloxone storage, in original packaging at room temperatures, avoid exposure to light, keep naloxone easily accessible in case of emergencies. So depending on which location you are at, make sure that you have an understanding of where the naloxone is stored, how to get at it, and familiarize yourself with what that looks like. The naloxone disposal talks a little bit about syringes here. We're not too worried about that as we're not going to be using the syringe format. So we're going to get into responding to an opioid overdose. All right, so you can see our 5-step process here: shake and wake, call 911, give naloxone, rescue breathing, recovery position, and care for the person. So the instructions for responding to an overdose, they're going to be presented in this section for the purpose of training. However, I think it's important to note that these steps could occur simultaneously if there is more than one person on the scene. So if someone is not breathing, it's important to give them rescue breaths and chest compressions. You know, I go back to is 4 minutes without air can cause brain damage. The American Heart Association recommends providing rescue breathing before administering naloxone. Each one of you should be trained in CPR and then, you know, therefore able to administer chest compressions and rescue breathing. Again, and I cannot say this enough, do not forget to call 911. If at a bare minimum you suspect somebody is overdosing, it's your ethical responsibility to call 911. So let's start with step 1, shake and wake. Some people use the term shake and wake and others say rouse and stimulate. Either or, it means the same thing. So we're focusing on making loud noises and shaking the person to elicit a response. Rouse and stimulate encourages performing a chest rub if you don't know response to the noise shaking stimuli. This purpose is to ensure that the person is in fact in medical distress, right? So shaking the person's shoulders, yelling, "Are you all right? Wake up." Rubbing on the sternum, making a fist, and using your knuckles to firmly up and down press on the breastbone. Call 911. Calling 911, right? It's so important, especially with trends in fentanyl in this area. It could take several doses of naloxone in order to reverse an overdose. So the sooner that you can have emergency services on the way, the better. You know, naloxone is really like pushing the pause button on the remote. Eventually things are going to start playing again. So what to say when we're talking to a 911 operator? Where are you? Do you know the address for Casa Clara, for Mooring House, for whichever facility that you're at? If you don't, learn it. What are you observing? What are the symptoms, right? Has the person turned blue? Are they waking up? What's their breathing like? And telling the emergency responder on site, right? If you know what it is that the person has used or how much they have used, pay attention to when the naloxone was administered, how much, and at what point in time. So giving the naloxone, so there are 4 versions that we go over. Again, for the sake of this, we are just going to talk about the nasal route and we'll go from there. So the Narcan nasal spray. So the box of Narcan includes instructions, but there's also instructions on each individual dose. So you're going to want to remove the Narcan spray from the box, peel back the tab with the circle to open it. So you're going to hold the Narcan nasal spray with your thumb at the bottom of the plunger and your first and middle fingers on either side of the nozzle. There's a nice little diagram on the side of the page here that shows you where to hold and where to push. So the Narcan nasal spray, to use this, you're going to want to tilt the person's head back and support the person under the neck. Gently insert the nozzle into a nostril. Keeping your fingers on either side of the nozzle and making sure that your thumb remains on the bottom of the plunger, and that the nozzle itself then is against the bottom of the nose. So press the plunger firmly all the way in to administer. Keeping in mind, with other forms, you have to prime the injection or whatever. It's not the case with the Narcan. Once you push the plunger, the naloxone is administered. It's just like a nasal spray you would use for allergies. You're going to want to give 2 to 3 minutes for the naloxone to work. Continue resuscitation if it's necessary. If breathing is not restored after 2 or 3 minutes, give another dose of naloxone. Continue resuscitation and stay with the person. Provide care as directed until medical help arrives. If you do need to give another dose of nasal naloxone, use the other nostril. So we are going to skip through some of these, and we're going to talk a little bit about rescue breathing. So remember, we're going back to assessing the breathing. Look, listen, feeling for breathing. Start rescue breathing right away if their breaths are short, shallow, or if the person is not breathing at all. So slow breathing for an adult is approximately less than 1 breath every 5 seconds. Rescue breathing is going to be the quickest way to get oxygen back into this person's body. And it's really one of the most important things you can do to prevent someone from dying or getting brain damage from experiencing an opioid overdose. If the person is not breathing or breaths are shallow or short, give rescue breaths, or follow 911 dispatcher's instructions, or give CPR if you are trained in it. We're all trained in it. So chest compressions and rescue breaths. Brief reminder of rescue breathing instructions. So making sure we're removing anything blocking the airway with a finger sweep, laying the person face up on a flat surface and tilting the chin to open the airway. So keeping in mind the most common item found in an overdose patient's mouth is the cap from the needle. that they might have used to inject themselves. So we're continuing with rescue breathing. You're going to pinch the person's nose closed, cover the person's mouth with your mouth, and blow 2 regular breaths, about 1 second each. And you're going to continue breathing, giving 1 breath every 5 seconds. At least 1 volunteer should demonstrate rescue breathing now with a mannequin. That's complicated when you're doing this online. So the recovery position, this is another piece that is crucial, when providing care to a person after an overdose. If you have to leave the person, even for a few seconds, put this person into the recovery position. This is going to keep the airway clear and prevent this person from choking or aspirating if they vomit. So we're going to want to turn the face and body to the left side, using their hand to support their head and bending their knee to support their body. You'll notice steps 1 through 4 on the side here. Those are going to offer some, hopefully, clarity in how to be doing this. So going into specifically caring for this person. So after a person gets naloxone, they could become physically ill. They could vomit. They could start to feel withdrawal symptoms. Those aren't going to be life-threatening, but they are going to be unpleasant. Some people get agitated, upset. Some people seize, and some people experience overdose again. A person who is overdosed really should be monitored for at least 2 hours or more afterwards to ensure that the overdose symptoms aren't going to come back. Stay with the person until medical help arrives. Put the person in the recovery position if you have to leave. I understand that a number of house managers or staff are going to be sometimes working by themselves, so I can't emphasize the importance of using that recovery position. You want to keep calm and encourage the person to not take any more opioids. That's never going to prove to be helpful. And again, if overdose happens, giving another dose of naloxone using the opposite nostril that was used the first time. So that moves into this last section that's going to talk about help that is available. There's information on 211 Wisconsin Addiction Recovery Helpline on here. If you have any additional questions or are looking for the remainder of the slides, feel free to reach out to me and I will gladly do my best to get that to you.